With a deep-seated passion for integrative medicine and a commitment to personalized care, Dr. Sowmya approaches each patient with understanding, holistic perspective, and compassion. Her unwavering dedication to promoting well-being encompasses not just absence of illness, but the cultivation of vitality and balance in mind, body, and spirit. Dr. Sowmya believes in empowering her patients with the knowledge and tools they need to lead vibrant, fulfilling lives. Step into a world of comprehensive wellness where Dr. Sowmya's expertise and compassionate care guides you towards your healthiest self. Dr. Sridharan holds a doctorate in naturopathy from the United States College of Naturopathy, a bachelor in homeopathic medicine and surgery from India, a research master's in physiology and neurobiology from the University of Connecticut, and an advanced practitioner of homeopathy license from the Nevada Board of Homeopathic Medical Examiners. So deeply educated, really has taken the time to investigate and educate herself and really have a deep knowledge of how the human body works and what we can do to bring it to better wellness. So she's deeply knowledgeable, incredibly compassionate, and one of the smartest ladies I know. So please help me welcome Dr. Sowmya Sridharan to the stage, and she's going to talk to us about emotional health.
Thank you. Thank you. Hello. Works. So, thank you for that. I am deeply grateful for what the Thermography Center has put up together for all of us to be here. Thanks to Dr. Michael Einstein. Without him, we wouldn't actually have all of this. He is so passionate to bring all of the professionals together. He's been working at it tirelessly for 7 months. So I'm very, very grateful for each and every one of them, and Kathy, who just made this amazing, and Pat, Marianne, everyone. Thank you so much. Thank you, Marta. So I want to summarize a little bit of some of the things that we heard today, because I thought every speaker was so helpful in pointing out some aspects, and I thought, wow, that's awesome. This is awesome. And so sometimes by the end of the day, we don't even remember what we actually heard, right? Because there was just too much of information. And so I just thought, maybe I'll just point out some things from each of them that I have taken personally myself, and I've actually used in my life as well. So starting with, I'll actually start with the DNA person. So I actually have used their SNP DNA kits with my patients, because a lot of my patients aren't actually good detoxifiers, which means they do not eliminate well the things that are actually coming in. So you heard from every speaker that there are all kinds of crap in this world, right? We all can agree. So now, what actually changes someone who's healthy versus who actually has a problem is someone who does not eliminate that. So the DNA kits have helped us understand who is a good eliminator, who is not a good eliminator. And that goes a long way. Again, they said there are solutions, and yes, there are solutions. You can support your body with certain kinds of nutrients, and now your body can become a good eliminator, and now you'll prevent diseases. So that's actually a fantastic tool that we have. The second person, Kiran, I use her face oil as well. I love her products, because we need non-toxic products. So many people talked about estrogen dominance. Estrogen dominance is one of the most leading causes of cancer. People actually keep talking about estrogen dominant breast cancer. And the reason why estrogen dominance happens is because of the cosmetics, it's because of the clothes that we wear, it's because of glyphosate, it's because of pesticides, it's because of, the foods that we eat, the water that's contaminated. So all of this actually increases our risk for breast cancer in men and women. And I am the one who's breaking the rule and saying cancer, 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 cancer. So, I'm known to do that, so it's okay. So, yes, it is. And I think we need to actually be okay with saying that, but not nearly normalizing cancers. So, and that is the reason why. So now we actually have products that are clean, non-toxic, that isn't going to increase our estrogen dominance, that's actually going to give us all of the things that we want, beauty and health and all of that, at the same time without actually taking away anything from us. The third person, Tony Ingram. So fluoride. Actually, fluoride, I have pretty much eliminated or never used anything with fluoride for a very long time, and still my oligoscan showed that I had high fluoride. How about that? But what can we do? So iodine is a very necessary nutrient that most people are deficient in, that actually is opposite to fluoride. So it actually eliminates fluoride from our body, but iodine is a necessary nutrient for our breasts, as well as for our ovarian health and for thyroid health. So for every single person, and for prostate health in men. So which means that iodine needs to really be in the conversation. So not just eliminating fluoride, but also adding something that will actually eliminate what's already in the tissues that's been placed because of who knows what. I mean, I could have been drinking water at a restaurant and got fluoride from it. I mean, I'm traveling and I'm going to get fluoride from some water or food that I eat, and it's everywhere. So that's another important aspect of it. And then now I have to actually remember who spoke after what. So Dr. Brian Ardis already spoke about the grounding mats that are so amazing, right? So now, why did I actually want to take this topic? I want to tell you a story. Okay, so a few years ago, when I was first introduced to thermography, through the Thermography Center of Dallas, now I actually do it in my own office because of how amazing of a technology that was. So when I had my thermography first, and I've been in practice at that point in time for 16 years, and now in practice for 21 years. But at that point in time, I really thought I knew something about medicine, something about health, and here I was teaching people how to be healthy. Lo and behold, get my thermography. What do I see? That I can actually develop breast cancer. And what do you think I thought? I actually wanted to quit practicing. Honestly, because I do believe in walking the talk. So if I don't really know how to take care of my own health, what business do I have telling other people how to be healthy? That just makes no sense to me. And that's not the business I'm in. I'm in the business of caring for other people's health, which means I really need to know what I'm doing for myself. So I was eating great. I was drinking great water. I was sweating. I was doing hot yoga. Everything that you should be doing, I was doing. But what was I not doing? I had no idea what my belief systems were, what my thoughts were, how my emotions were. And what did I do with all of the experiences, trauma, like Trace said, trauma? What did I do? I did what he did, the B demonstration, the second demonstration. That's what I did with my life. All of us have it, right? All of us have challenges. All of us have stress. All of us have had trauma. None of us are free from it. If somebody said here that I've actually never experienced anything bad in my life, come on up here. Anybody? So that's life. But what do we do with it? We are never taught what to do with it, right? We experience it. We are mostly taught to do what he did the second time. Okay, come on, especially for women, right? Don't be a girl. Don't cry like a girl. That's like such a common statement that we hear, that I used to be a very emotional child. I used to cry at the bat of an eye. And then everybody used to keep saying to me, stop crying. Why do you cry so much? Oh my God. You get on my nerves. Stop crying. And so then I stopped crying. And then I actually built a wall. I learned how to harden myself. And then something bad happens, nothing could touch me. I was tough. And everybody looks at me and says, oh my God, you're so strong. You're so fierce. Right? But fierce in my soul, fragile in my heart. But that part we don't actually get to show. And not that we actually have to wear our hearts on our sleeve, but at the same time, if we don't really know how to heal that heart, then we actually put it in our body. That thermogram was an eye-opener for me. It showed me what I actually did not know. The emotions, the chemicals that I was producing in my body as a result of those repressed and suppressed emotions that I didn't know what to do with. And those were wreaking havoc in my body. And there's no other way around it. And then I saw this time and time and time again with my patients. And then I actually had to learn how to deal with it myself first, right? Instead of quitting practicing, I said, okay, I need to go to work. I need to learn what to do with it. First, to recognize, just like what Trace said today, you have to recognize that this emotion exists. But then these emotions produce chemicals in our body. And these chemicals have a very, very, very profound effect on our body. So when COVID hit, so many people came with anxiety to my clinic. And they all said to me, oh, just because of COVID. Before that, I was perfectly fine. Do you believe it? Do you? No. Why? Because you don't just get anxious suddenly. You know, it's your nervous system that's always off a little bit. But it's kind of, water under the bridge. You don't necessarily feel it until everything is starting to collapse around you, right? So then they actually experience this. But again, most people are told that, okay, it's normal. This is normal. That is normal. Feeling this way is normal. And then they just actually live with it until it becomes overwhelming. And when it becomes overwhelming, they come to me and say, well, do you actually have a natural medicine to fix how I feel? Right? Because there are antidepressants. What do antidepressants do? What do anti-anxiety medications do? They actually stop you from feeling that way. So they're like, well, I've been on this medication for so long, and I don't want to be on this medication anymore. Can you give me something natural that will do the same thing? And I always tell people that, of course I can. It's true, right? These are chemicals, though, in our body. There are many, many chemicals that actually do this in our body. The reason why I want to talk about the mind is we eat how many times a day? How many times do we eat? Did you all forget? 3 to 5 at the most, right? So it seems like everybody forgot after lunch. So we eat 3 to 5 times a day at the most. And we all know that what you eat matters. Yes? Okay. So now, how many times do you think in a day? How many? More than you can count. What if I said thousands of times a day you think? And you produce chemicals every time you think. So you eat, you produce chemicals. You think, you produce chemicals. Which do you think actually has more impact on you now? The mind does. Your thinking does. So if your belief system is really detrimental to you, do you think you're actually going to be producing good chemicals in your body? Is it even possible? No matter how organic you eat, no matter how much sugar you delete from your, diet, you actually can take all of the antioxidants in the world. Are we actually going to get healthier? No. And this I've seen in practice. And again, I am a fan of going and finding solutions and looking at history, looking at how people behave and things like that, and always trying to make these pieces of the puzzle come together so I can actually make sense of what is happening, right? I mean, we're all medical detectives here. That's what we do, right? We go see a patient, and now we are trying to put all of these pieces of the puzzle together so we can make sense of what's happening to that patient, where the problem is coming from, how can I actually take them to the solution. So now, if that is the case, and this person is constantly thinking that, every time they look at themselves in the mirror, you know what actually happens? For most women, how many of you look at yourself in the mirror and say, oh my God, who is that beautiful woman looking at? Who's that? How many people? See, in a whole room, like 2, 3 hands went up. 4. How many men say that? Oh my God, look at that, I'm so goddamn handsome. How many men say that? 1, 2. Okay, he's like this. He's like, can I do that or not? Not even sure, right? So, but this is us. Do you know every time we look at ourselves in the mirror and say, oh my God, what is that wrinkle? Oh, is that a gray hair? oh my God, I'm so old, or, ooh, my forehead is big. Whatever it is that you actually say to yourself, whatever that's yours, got it. So whatever your choice of poison is, it produces serotonin. You know what that chemical does? You know what that chemical is actually produced by? I'm going to go here. Okay. It's punishment. Punishment is mediated by serotonin. Okay, so when somebody else punishes us, right? When we are children and our parents punish us, we actually say, oh my God, that was abuse. My parent did this, and I felt so ashamed. I felt awful. So serotonin is the chemical that's actually produced, okay? This serotonin, when it's actually in a balance, it makes us feel serene, makes us feel good. But otherwise, it actually makes us feel awful, shame, small. So this chemical is what we are producing every time we look at ourselves in the mirror and say, ugh, what's wrong with my face? Or whatever it is that you say. So now, this chemical increases cancer risk. It acts as a cell proliferator. It feeds cancer. How about that? So no wonder there was a cancer risk for me when I looked at my thermogram. Because I wasn't kind to myself. I didn't even know that was a thing. We are taught as a culture to always look at our faults, look at our problems, look at what is wrong with you, then you can get better. Okay, I don't think it's actually working. So I think today as a society, maybe we need to decide that we are actually going to cheer ourselves on to do better rather than keep finding what is wrong with us. Right? And then the norepinephrine, it's a chemical that's responsible for fear and anger. So after you heard Dr. Arda speak, how many of you felt scared? It's true, right? How many of you felt scared or angry even at the government, at whatever, right? So again, we are going to feel these emotions. I'm not saying don't feel these emotions. That's not what I'm saying. But these emotions have a chemical path to it. It is norepinephrine. So norepinephrine, it's actually responsible for many different things in our body. In normal, good way, when it's produced, it helps our airway be open. So it's wonderful for people with asthma or people with any kind of respiratory illnesses. We need norepinephrine. See, none of these chemicals are bad. So every chemical actually has a positive and a negative impact if it is not done properly. If we are producing too much of norepinephrine because of anger and fear, it's not good. But if you're producing it in certain amounts, it actually keeps our airway open, it reduces inflammation. So it's always like two sides of the coin. It just matters which side of the coin we are hitting on over and over and over again. And it has an effect. So all of the different, all the slides you'll actually have access to, and all the studies are up there as well. And I really don't want to keep repeating what's on there. That you can actually read. Every single neurotransmitter has an effect on your body. GABA, glutamate, norepinephrine, serotonin, dopamine, all kinds of things actually have a great effect on our body. Sometimes good, sometimes not so good. Okay, and that's the way it works. But one story I want to tell you is this. So when we hear cancer, this word, we hear it all the time now, right? It's in our, maybe a family member, a friend, somebody actually has this. And I want to tell you a story of a patient of mine. So this patient of mine, she came to me a few years ago, and she had ovarian cancer. So when she came to me, she didn't have ovaries. So the first time she was diagnosed with ovarian cancer, she went through conventional treatment. Her ovaries were taken out, and she went through chemotherapy, radiation, and then she came out of it, was said that she was actually in remission, gone. And then a year and a half later, she actually went back because she developed ovarian cancer again. Mind you, she does not have her ovaries, but the ovarian cancer came back. So the tissues that were in her pelvis were off the ovary, so the ovarian cancer came back the second time. And again, went through more surgery, removed everything else in the pelvis, pretty much the pelvis is now like a completely empty, space, and went through more chemo, more radiation. Again, another 1.5 years passes, third time comes back. So that's the time she comes to see me. So now, the third time, obviously, these are some of the cases, like when we see these patients and, you have actually interacted with them, it stays with you forever and ever. It will never go away, because these stories impact you as much as it impacts them and their families. Because it's such, this is a human being with her own desires and wanting everything out of life. And here it is, she is literally, grasping at the straws for her own life. And let me tell you why she actually developed cancer. You want to know? Okay. Because she went through a divorce and her children were taken away from her in a custody battle by her husband because he was making more money and she was a stay-at-home mom. And she lost custody of all 3 kids and barely got to see them, and it broke her heart completely. And nothing that you could say, do, could actually change it. And nobody ever paid attention to that aspect of it, because what is emotions? It's no big deal. You just suck it up and move on, right? So, which is what she did. And then she developed ovarian cancer. And then again, it was treated again and again medically, removing organs, killing more cells, and, making everything toxic in her body. It still did not actually change the fact that why she developed cancer was never addressed. It never was healed. So how could the cancer go away? It has to keep coming back, isn't it? It has to keep telling her, hey, you haven't actually healed me. You haven't healed me. You haven't done what you need to do. So it kept coming back. So the third time around, as we talk about it and understand all of these things, and I actually told her that, okay, so she actually had bleeding on a regular basis. So that's how she knew and went back. And when she actually developed bleeding and it was happening every day, and they said, oh, even the chemotherapy drug wasn't working anymore. So there was nothing to be done anymore, which is the reason why she came to see me, because they pretty much told her that you're not going to live. The drugs aren't working. So just get your, things in order, and that's all. You just live off whatever you have left. And so when she came to see me and, I put her on a diet, talked to her about her mindset, worked on all of those kinds of things, 3 weeks later, her bleeding stops. Okay, so which is actually huge, because that means that her body is trying to correct something in there, right? And then she was starting to gain weight, starting to feel better, color comes to her skin, and she was very excited about everything. And then I see her the last day. I was going on a vacation to India for 3 weeks. So I tell her, see her, I say, oh my God, you're doing fantastic, keep up with it, good job, everything is awesome. I'll see you when I come back. I'm seeing you right after I come back. That's the first day I'm back in office. I'll see you then. And I leave. And then what happens? So she goes to see, because her medical doctor calls, or their office calls and says, you need to come in for your blood work. You haven't come in for a blood work in a while, so you need to come in for a blood work. So she goes, and they actually measure a marker for cancer and say, oh my God, it's so high. You need to get your affairs in order. You're going to die within 3 weeks. And she passed away before I came back from India. And that is the power of beliefs, because she believed that she's not going to live anymore. Somebody told her that. And everything that we did before was moot, because she didn't believe it anymore. And I've actually seen this in so many of my patients. One of my patients with breast cancer, she said to me, so she and her husband didn't really have a good relationship. And so she said, 7 years prior to developing breast cancer, she said that, she was in depression. And as she was depressed and taking an antidepressant, she said, I wished I actually got breast cancer and died. Yep. She wished she had breast cancer and died. How about that? And it's interesting because she didn't realize this. So as I was talking, we are always going to come to find out, history, getting history, and talking about like, how did you feel, what happened, and all of those things. I was asking her, and she said, I was taking an antidepressant. Why? And then she told me all the history. And then at that time I said, so how did you feel when that was happening? And she's a beautiful woman. And so then I actually asked her about the intimate life of her and her husband's. And that's when she said, no, we don't actually have one. I said, how come? She said, I don't know. My husband doesn't really want it. I said, okay, that's interesting. You never have had a conversation about it? She said, we have, but it really hasn't gone anywhere. So I went into a deep depression 7 years ago because of that, because I felt like, I wasn't attractive anymore. See, again, coming back to self-abuse, when another person does that to us, what kind of language do we speak? I am not attractive. I am not good enough. Not that that person doesn't want this, but something is wrong with me. So who needs to die? I need to die. But this is what we do to ourselves. And these are all very subtle, right? I'm sure she never even realized that she wished it to reality. But when we talked about it, she said it, and as she was saying it, she said, oh my God. I said, yeah, okay. I said, do you still wish it? She said, no. I said, okay then. All right, let's do something about it now. Right? But that's how powerful our thoughts are. And then the chemicals we produce. What are our thoughts? Did you know that our thoughts create emotions every single time? And those thoughts produce chemicals that produce emotions. And these emotions and these chemicals produce changes in the body, in different organs. Just like it says here, anger in the liver, happiness and grief in the heart. Thoughtfulness, heart and spleen. Sadness, heart and lungs. Fear, kidneys, heart, liver, and gallbladder. Just notice that, fear. How many organs it's actually impacting more than other emotions. So which means that fear is really pretty much the basis, and that's actually at the bottom of the energy, field pretty much. It's at the bottom because fear pretty much is where everything starts. Surprise, heart and gallbladder anxiety. So instead of, again, going into all of these different organs, what I really want to do is I actually want to show you something. I want to demonstrate something. And she doesn't know what I'm actually going to do. So I just said to her that I'll actually call her out. So put your arm out for me. So, and you all know already from Trey's thing as well, that energy is all it is, right? So energy is where everything starts, and then everything else works from there. Like your circulation, your organs working, tissues functioning, everything happens because the energy is functioning optimally. If the energy is not circulating, nothing is going to work. When we die, 8 grams gone, that's energy, and that's it. End of life. So that 8 grams does everything else on the whatever 110, 120 pounds of us, or 200 pounds of us. So I'm just hold strong, okay? And don't let me push you down. Okay, so she's pretty strong, okay? And I'm not going to say anything. I'm going to just think it, okay? At her, for her, okay? Put your arm up. There you go. So what I actually thought before I say that, put your arm back up. And I'm going to actually restore it back again. There, she's back. So the first time, what I actually thought, I just thought, I didn't say it. I said, you're ugly. And her energy dropped. That's it. And then I said, you're beautiful, and her energy got reestablished. So this is happening to us all of the time when we are talking to ourselves. So your energy is dropping every time you actually say anything negative about yourself, and your energy picks up and reestablishes itself and gets strong every time you say something good about yourself. Thank you. Thank you. So, and it's not just cancer, it's actually all the other diseases. Whether it is autoimmune disease, whether it is liver issues, whether it is GERD, all of these things, emotions play a huge role. And people will tell you all the time, stress makes everything worse. Stress makes me achy. Stress makes me have joint pain. Stress makes me have, a acid reflux. Stress makes me have diarrhea. right? So stress makes us do all of these things, but what does this stress mean? And this is another one that I actually really, really want to point out to every single one of you. There is something called as an emotion wheel, okay? Emotion wheel is something that you can actually find online, okay? You can print it out and keep it in your house. Why is this important? Because we are putting everything under the category of stress. Anything that isn't feeling good, we say, okay, I'm stressed. But instead, I want you to start expressing the exact emotion that you're feeling. You may not even know what emotion you're feeling yet, because we are only told a few things. Like even I only wrote down 5, 6 emotions, right? But there are many other emotions we feel: betrayed, disappointed, frustrated, irritated, right? Disgusted. There are many, many, many emotions we feel. And it's very important to name an emotion that we are feeling so that we can actually identify. For example, if I have a cut on my skin, if I don't know where the cut is, how am I going to treat it? Can I actually fix it? Or I'm going to keep enduring it and making it worse, right? So instead, if I actually know what that emotion is, then I can understand it and then heal it. So it's very important to understand what you are feeling rather than just putting it all under one category of stress. So stress and breast health, specifically, stress affects immune system health. And people were talking about macrophages and how actually, bad things, if there are certain kinds of bad things, even cancer cells, there are immune system cells that will come and eat it up. But if we are under any kind of stress on a regular basis, we are talking about the baseline. We are not talking about your stresses that come up and down. Sometimes something happens outside of our, body. And we can't always control that, right? Deaths happen in our life, financial struggles come, all kinds of car breaks down, AC breaks down, all kinds of things happen in our lives. These are things that will be coming and going. But what is more important is how long do I stay in that stressed state? Am I able to shift out of it? What are the things that you're doing for fun? What are the things that you're doing on a regular basis that actually takes you out of that stress response and keeps you in a baseline of more joy and happiness? Hormonal imbalance, again, we talked about many of the different things, but emotions play a role in fibrocystic breast diseases, in tenderness, in breast pain. All kinds of things are happening because of stress and hormonal imbalance. Weight gain, there's all of these studies, and it's just amazing how many studies are there. So naturally, what we want to do is take care of all of your food and all those aspects of it, which is wonderful, but at the same time, make sure that you are keeping a baseline of joy, have a beautiful community. That's, again, missing so much in these, time and age. We are all trying to isolate ourselves or trying to do this all by ourselves. We don't need to. Okay, we can all be warriors, but we can be warriors together. We don't need to do this ourselves at all because there is no point in doing it alone. Okay, there is more joy in actually doing it together. So tell a friend if you are having, trouble. Talk to somebody. Ask them for help. It's okay. It does not make us weak. It actually makes us stronger. Thank you.